We often think we understand common health issues, but sometimes there are big misunderstandings out there.
That's right.
So today we're diving into celiac disease based on the sources we looked at.
Mm-hmm.
And our mission really is just to clear up some of the things people often get wrong about it.
Exactly. Looking through the material, it's really clear that medical knowledge about celiac disease has moved on quite a bit,
Right.
but public understanding
Right.
maybe hasn't quite caught up. So we want to tackle that gap.
Okay, let's get into it then. One thing that kept coming up in the sources was the mix-up between actual celiac disease and general gluten sensitivity.
Yes.
It feels like people use those terms almost interchangeably sometimes.
That is a really key misconception. Celiac disease is specifically an autoimmune disorder.
Autoimmune, okay.
Yeah, so when someone with celiac eats gluten, their immune system basically attacks the small intestine. It causes damage,
Wow, okay. Damage.
which, can lead to pretty serious long-term health issues if it's not diagnosed and managed.
Right. And gluten sensitivity is different.
It is different. With non-celiac gluten sensitivity, people get symptoms after eating gluten, sure, but they don't have that same autoimmune reaction. There isn't that intestinal damage happening.
Ah, okay.
Yeah.
So it's not just about how bad the reaction feels. The actual biology behind it is different.
Precisely. That's the core distinction. In celiac, the body is attacking itself. That's not happening with gluten sensitivity.
Yeah, I guess that means how you diagnose them is different too.
Absolutely. For celiac disease, the standard route involves blood tests looking for specific antibodies and usually an intestinal biopsy to confirm damage.
A biopsy, right.
Those tests wouldn't typically be positive for someone who just has gluten sensitivity.
Huh. So someone could, cut out gluten, maybe feel a bit better, and just assume, okay, I have celiac disease.
That happens a lot, yeah.
But it might be something else entirely, or maybe just the sensitivity.
That's a very common scenario. And look, a strict gluten-free diet is the only treatment for celiac disease. It's lifelong.
Lifelong, okay.
But someone with sensitivity might feel better just reducing gluten. Or maybe they find other foods are triggers too. The danger is if someone does have celiac, but just self-diagnoses or assumes it's sensitivity.
They delay getting proper medical help.
Exactly. And they risk those long-term complications because the underlying damage isn't being addressed properly.
It almost seems like the whole, the trendiness of gluten-free diets for general wellness might have, muddied the waters a bit.
That's a really interesting point. I think it has, to some extent.
But it seemed less serious, maybe.
Perhaps. With gluten-free options everywhere, it's easy for some to maybe see celiac as just another dietary choice, like being vegan or low carb.
Instead of a serious medical condition requiring really strict management.
Right. It's an autoimmune condition that needs careful, lifelong adherence to that gluten-free diet to prevent real harm.
So what's the takeaway here for people listening? It sounds like it really underlines how important it is to get proper medical advice, rather than just, following trends or making assumptions about symptoms.
Absolutely critical. If you suspect gluten is causing you problems, the first step should be talking to a doctor. Get the right tests.
And you mentioned testing. Does going gluten-free before testing cause issues?
It can, yes. That's a crucial point. If you stop eating gluten before you get tested for celiac disease, the tests might actually come back negative even if you do have it.
Oh, wow. Because there's no gluten triggering the reaction for the test to pick up.
Exactly. The antibodies might go down, the intestinal damage might start to heal, which sounds good, but it means you might not get an accurate diagnosis.
Man, that really makes you pause and think about how easily health info gets, kind of twisted or oversimplified out there.
It really does. And it brings up a bigger question, doesn't it? How do we get better at talking about these health conditions, explaining the nuances?
Yeah, so people understand the real differences
Mm-hmm.
and the potential seriousness. Okay, so wrapping this up, the main point seems to be celiac disease, gluten sensitivity. They both involve reactions to gluten, sure,
Right.
but they are fundamentally different conditions, different mechanisms, different long-term implications.
Couldn't have said it better. Clear, accurate information is just vital for getting the right diagnosis and the right management plan.
Absolutely.
And that leaves us with a final thought for everyone listening, I suppose. Thinking beyond celiac. What other health topics do we tend to talk about in really broad strokes? Where maybe we overlook the complexities, the important distinctions, and how might that affect how we think about our own health?